Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing okay, all things considered.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be answering a viewer-submitted question, as well as addressing the latest headlines submitted through today, July 17th. We welcome any questions or comments down below. Starting today with the major story across the Midwest and the United States, the Cyclosporiasis outbreak continues to grow, and there may be an identified source of the outbreak. Can you bring us the latest, Dr. Murphy?
Yeah, well, there's probably well over 7,000 cases right now. The CDC is reporting 1,600 laboratory confirmed cases, but the states are doing it their own way. They're including some cases that are not laboratory confirmed, and the numbers are really high. So Michigan is the worst, or I should say reporting the most at 4,312 cases as of yesterday. Ohio has 364. There's 34 states reporting cases and 141 hospitalizations. Fortunately, if you can keep up with the fluids and stuff, this is not a life-threatening disease, but I mean, it's certainly not fun to have. What happened yesterday, there's been many outbreaks in the past, and it's contaminated water and fruits and vegetables that are contaminated with human feces somehow in the water, bad sewage, and we've had outbreaks in the past. And some of them have been associated with lettuce and the like. Basil, there was a big outbreak with basil imported from Guatemala, I think. Anyway, the CDC and FDA think the likely source is the shredded lettuce, iceberg lettuce served at Taco Bell restaurants in Michigan, Indiana, Kentucky, Ohio, and West Virginia. They have a single distributor in that area, and it's a company called Taylor Farms. The headquarters is in California, but the lettuce is coming from Mexico. And they're trying to find Taylor Farms also supplies all sorts of other stores. I mean, including Whole Foods and Walmart and everything. So this stuff could be really everywhere. And the recommendation was made already last week that, don't buy the prepackaged lettuce, buy a whole head of lettuce and remove the outer leaves, discard them, and wash the part that you're going to eat if you're going to eat lettuce at this particular point. But certainly anything from Taylor Farms you should avoid. And the other ones, it depends where their food really comes. Taylor Farms. I mean, it sounds like it's in a Michigan company or something. No, it's California, and the food actually comes from Mexico. So it just tells you that these supply chains that exist now, they can spread things around the country very quickly. And so that's a phenomenon we have to keep in mind. You mentioned already there was an outbreak. Taylor Farms has been associated with an outbreak of E. coli, the dangerous one, from slivered onions that certain McDonald's picked up. 104 people got sick, and one person actually died. And there was a 2013 cyclospora outbreak that sickened more than 600. So something's going on here that needs to be followed very closely, and appropriate policies have to be put in place to preserve the public health.
Absolutely. And we do have a viewer submitted question today, a great one from a longtime viewer, and it is asking about the rates of COVID-19 during the summer. Do we expect to see those summer bumps, or are the very low levels a sign that the summer peaks have left us behind?
Yeah, this is a really good question, and it's really hard to answer because we don't collect COVID diagnostic test results anymore. So, and the mortality rate for COVID has dropped, but there's still as many people dying of COVID as there is the flu. if not more. So, I mean, COVID hasn't gone away, but the big peaks that we had in August, remember the Delta one, and then every year we've had this peak, like right about now through August, and then it goes down. And then it pops up again with the other respiratory diseases in starting in December and through March, April. So, what does that mean? So we don't really know, but we expect a peak. Overall, the peaks have gotten smaller, and people are doing better with COVID. There's treatment for COVID, and there's vaccines for COVID. The problem with the vaccines is not so much the toxicity, that's been looked at very closely, but the fact that the effect wears off so quickly. So there'll be a new vaccine, a new COVID vaccine out in September. And I highly recommend anyone who's going to take the vaccine, anybody with any underlying diseases, particularly pulmonary diseases or heart diseases, everybody over, 65, anyone who's frail in any way should be taking these vaccines. And so that'll be out there. They're in the process of combining it with the flu vaccine. We reported on that several weeks ago, looking at it actually works better. And just take what you can get when you can get it, but wait for the new one. Now we're so close to getting the new one. You should wait for the new vaccine and take that one.
Absolutely. Great advice there. But if we turn our eyes to the East Coast of the United States, specifically in New York City, we're seeing a Legionnaires disease outbreak. Can you remind us what that is and what's going on with this outbreak?
Yeah, Legionnaires is a bacterial disease, causes a very severe pneumonia, and it grows in water cooling systems. And the Upper East Side neighborhoods of Carnegie Hill and Yorkville have 63 cases as of July 15th. They're finding it in many of over 70 cooling towers in the area tested positive. And of the 63 cases that they 12 have been remain hospitalized and 40 have been discharged. So no deaths recorded so far. So it's typically a disease diagnosed in the hospital when you come in with pneumonia. That's the point. So the bacteria is spread through the inhaled water vapor rather than the plumbing or the cooled air. So if you look for it, you find it. But these outbreaks, people are just exposed to too much of it, and some of the places may be more contaminated than others, and you find these outbreaks now. So it's treatable, and people who have underlying lung disease or heart disease are, of course, more at risk for having a severe outcome.
Mhm. We will keep an eye on those case numbers or any further identifications that can be made on the sources. But our final story today is a scary one. Out in the Democratic Republic of Congo, there continues to be transmission of the Ebola virus and this outbreak. Can you tell us about it?
Yeah, this is really not going in the right direction. They're having hundreds of new cases reported per week. There's over 2,000 confirmed cases right now with 754 deaths. I mean, this is a very dangerous infection. Sadly, 80% of the new cases are emerging from unidentified transmission chains. That means they're just coming in, nobody knows how they got it. And that's a very bad sign. They, the overall public health response has really been severely blunted. It got delayed at the beginning, and you can see you delay and it just doubles, 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 and all of a sudden you got too many cases to deal with because the tests they were using didn't cover the strain that they have there. And they really need a lot of help here and a lot more money. Of the 115 million funding appeal, the WHO has only received 40% of that. That's just definitely not enough for something like this. This is going to be worse than the West African outbreak that we had. Two other things about Ebola right now. There are two drugs, remdesivir, which we use for COVID, and a monoclonal antibody called MBP-134, And there are trials of that going on now in some of the areas where they have a lot of infected cases. So that's good. And then, but the U.S. has a policy that really doesn't make any sense here. American citizens who are in the Democratic Republic of the Congo, probably volunteers, okay, trying to get this thing under control. I mean, these are real heroes. Um, American citizens departing the DRC now must spend 21 days abroad before they come home, even if they have no symptoms. I mean, how irresponsible is that? First of all, the asymptomatic people are not big spreaders of this disease. And to leave them in another country, it just is completely irresponsible. It's okay. If you want to quarantine them, go ahead. Like we did with the hantavirus, and we quarantined them that was 42 days, I believe. We should take our own citizens back. These people are really trying to help the world, and that includes us. So that's a very, very weird public health move on the part of the CDC and the USG. So anyway, that's the story right now. It's looking pretty sad, and this is going to get worse.
Yeah, we will again keep our eyes on this story as cases continue to grow. Hopefully, the response can be stepped up with additional funds if they are received. And thank you, Dr. Murphy, for keeping us up to date on all that is going on this week in public health.
Well, thank you, Katie. Stay healthy. Try to stay indoors today.
Yes, try not to breathe in that wildfire air. And thank you all for joining us for this week's episode. We hope to see you back next week. As always, thank you for your question. And if you have any more, please feel free to submit them down below or at any of our social media. We'll see you next week.